Welcome to another episode of Easy IVF. Today we'll be talking about causes of infertility in men. In our last video we discussed about the issues or about the causes of infertility in women, and let's just focus more on men. As we know, 35% of infertility stems from the women, and also 35% of infertility stems from the men. So, and then the other 30% is obviously of unknown causes. Like we've discussed in the past, infertility is the inability to conceive after or within 12 months of regular, unprotected sexual intercourse. In men, however, the causes of infertility can sometimes be a clear cut, sometimes it's just unknown. The presence of abnormal sperm sample or the presence of poor quality sample does not necessarily lead to an absolute inability of a partner to aid you to conceive. Your chances of conceiving with reduced sperm parameter would reduce. Let's just get down to the main causes of male infertility. The first reason why some men are infertile is testicular disease. Testicular disease, diseases affecting the testicles. It could be pathological, it could be of genetic origins, and at times it can be a direct trauma to your testicles. Klinefelter syndrome is a genetic hereditary disease that is caused by the extra addition of the X chromosome. So a male child is born with an extra X chromosome, so that would be XXY instead of XY. So that could cause the reduction or the absolute disappearance of sperm cells in the testicles, and that would lead to difficulty in aiding to conceive a child. Another thing that affects the testes is testicular maldeascence, right? So during the in utero formation of a male child, the testicles are formed, kind of descends from the abdomen down to the pelvis, and obviously they protrude externally. That's why you have the testes hanging out. They are not inside the body. So during development, some of these testes do not actually descend, right? So when the testicle does not descend, it means that your testicles are inside your body. The heat in there would obviously destroy the sperm cells that will be formed, and that would obviously lead to infertility. Another cause, still on the testicular issues, like things like testicular torsion, or when you have severe infection to the testicles, or you suffer from diseases like mumps, that would obviously affect your ability to reproduce. And when you have direct trauma to your testes, that will trigger a hormonal response or response to an inflammatory response to wound healing that would cause inflammation at the site. And when there is inflammation at the site of the testicles, that causes more blood cells obviously to gorge towards there to cause repairs. And during that period, due to that inflammation, right, there's redness around that area. That heat around that area can actually cause a temporary or a permanent damage to your testicles, and that would lead to infertility in men. The second cause of infertility in men is obstructive male infertility. As we know, you have the testicles, you have a urethra, you have a duct that connects with your urethra, and that comes out to that opens up into the penis, right? So when there is an obstruction in the urethra, or when there's an obstruction in the seminal ducts, or when there's an obstruction in your vas deferens, that will hinder the movement of sperm from your testicles through your urethra, and that would affect the sperm content of your ejaculate. When you do have an obstruction in your reproductive tract, that would obviously cause infertility. So things that can cause obstruction can just be, again, inflammatory disease or hereditary. At times, men that suffer from cystic fibrosis or men that are born with cystic fibrosis have what we call a congenital bilateral absence of the vas deferens. And so when you don't have any vas deferens at all, then there is no way for your body to transport the semen or the sperm cells that it produces towards the urethra for that to be ejaculated. When you also suffer from neurological disease or even psychological disorder, can lead to erectile dysfunction. Diseases like diabetes mellitus can also affect the erectile capability of a man. And when you don't have an erection, that does not give the body enough blood flow and drive to cause that would lead to an ejaculation. And when there is no ejaculate, you're not able to obviously conceive without the aid of in vitro fertilization. Another cause of infertility is varicocele. So varicocele basically means that you have varicose veins, right, in the scrotum. And so when you have varicose vein down in the scrotum, that causes fluid to accumulate, and the accumulation of this fluid will cause an increase in the scrotal temperature, potentially affecting the formation of new sperm cells. One other cause of infertility in men is autoimmune diseases. So some men actually develop auto-antibodies to their own sperm. So basically after, let's say for example, you have a scrotal surgery or vasectomy or trauma. After that trauma or after the surgery, you could develop an antibody that could now affect the sperm function and possibly the fertilization capabilities of your partner's eggs. If you do have those antibodies in your sperm, that would obviously affect the ability of your sperm to fertilize an egg. The type of work men do at times, or even the type of exposures they have at times, can also affect their fertility. Exposures to chemicals, radiation, and say for example the type of occupation you actually do can affect your sperm quality. Occupations like long distance drivers, people who work in welding industries where they are exposed to high temperatures, those can affect the quality of the sperm and also the sperm function, and obviously that can affect their fertility. Let's talk about drugs. So prescribed drugs like steroids, opiates, and even chemotherapy and radiotherapy can affect the sperm quality and the formation of new sperm cells. I always say that before you go in for a chemotherapy, make sure you freeze your sperm. I'll leave a link and the video on sperm freezing just at the end of this video. Non-prescribed medications like, say for example, anabolic steroids that you take for gym workouts and weightlifting, things like marijuana. There was a study that shows that marijuana consumption can and may affect your sperm quality, and that can potentially increase your chances of having miscarriage. That being said, I am not saying that people who consume marijuana are not able to have healthy babies and healthy pregnancies, but it might increase your chance of having miscarriage. Alcohol and tobacco can also affect the sperm function and the formation of new sperm. Finally, one of the other causes of infertility at times we just don't know, it's unexplained. Say for example, on the molecular level, the lack of PLC zeta, which is an enzyme that has the ability to cause egg activation, the lack of PLC zeta can obviously lead to infertility. So you could have normal sperm parameters and the eggs are fine, the ovaries are fine, everything on the female side is great. But when you do have a molecular absence of some of the enzymes that causes the activation of an egg, obviously you won't be able to fertilize an egg, and that will lead to infertility. Your sperm quality might be great, the movement, the motility, the morphology, all that stuff might be great. When there is a molecular problem that is not diagnosed, then obviously that would cause infertility. So these are just some of the most common causes of infertility, and I hope that helps you understand why I am pro freezing, I am pro banking. It's just the same way you bank your money when you go to the bank so that you can have money in the future to use. That's the same way you should bank your sperm, so that when you're getting older, and maybe because obviously recently people get married older, when you're getting older and the quality of your sperm is getting worse, you do have the opportunity to reach out into the bank, the sperm bank, and grab the one that you froze when you were younger, and obviously that would be of a better quality. Thank you so much for watching this video, and cherish life.